Foreign body may be enter into the ear. The foreign body may be non-living or living. In the case of the non-living foreign body, non-living foreign body in the ear, the children may insert a variety of foreign body in the ear. The common ones are a piece of paper. Children may enter foreign body into ear. They may include piece of paper, sponge, grain seeds, the sponge and grain seed. The grain seed include any of but rice, wheat or maize are common, or slate pencil. Slate pencil may enter into the ear by the children. They may enter the matchstick for scratching. Matchstick for scratching. The children also enter the vegetables. Tend to enter into the ear for scratching. The vegetable foreign body swells up with the time and get tightly impacted in the ear canal or even separate the ear canal. Methods for removing the foreign body in the ear. Now we discuss the methods for removing the foreign bodies. Methods for removing. Methods for removing the foreign bodies include forceps removal, syringing, suction, microscopic removal with special instrument, and postural approach. Number first is the forceps removal. Forceps, the removal of foreign body by forceps. The forceps include the fine crocodile forceps. Fine crocodile forceps. The fine crocodile forceps is mostly used for the removal of the foreign bodies, which includes the piece of a paper, swab or piece of sponge. They mostly used for the removing of sponge, piece of paper, swab. Number second methods for the removing of foreign bodies is the syringing. The syringing technique, so we remove the foreign body from the ear. Most of the seed, grain and smooth objects can be removed with syringing. Syringing we remove seed, grains and smooth objects. We remove with syringings. Smooth and hard objects like steel ball, bearing ball should not be grasped with forceps as they tend to move toward the ear and may injure the tympanic membrane. In all impacted foreign body or those where earlier attempts of extraction have been failed, it perforates the tympanic membrane. To avoid this perforation, we use the general anesthesia, and general anesthetic protocol can be used, and an operating microscope is used. For these is the operating microscope used. Operating microscope is used under the general anesthesia protocol, because when we push with the forceps, that is crocodile forceps, they may enter into the ear canal more and they injure and rupture the tympanic membrane. Fourth is the postural approach. The postural approach is used to remove the foreign body impacted in the deep meatus, medial to the isthmus, or those which have been pushed into the middle ear. Those objects that have been pushed into the middle ear foreign body due to attempting of the removal, and they have been pushed into the middle ear, so these can be removed by postural approach. Sometimes the maggots can also enter in the ear Flies may be attracted to the foul-smelling ear discharge and they lay eggs in the ear. The maggots are the laid egg of fly because they are attracted by the foul-smelling ear discharge and they lay egg. This is called maggots. They are commonly seen in the month of August. They see in the month of August, September, and October. In these 3 months, they most commonly seen and they lay eggs in the ear. The presenting complaint is the severe pain with the swelling around the ear and blood-stained watery discharge. There is blood-stained watery discharge and intense pain. Intense pain is the presenting complaint of the patient. The treatment for this includes by instilling chloroform. Treatment is the instilling chloroform. Instilling the chloroform water to kill the maggots. To kill these maggots. When we remove the living bodies from the ear, note that first we kill the foreign body, that is living foreign body in the ear with the chloroform water. First we kill this and then we later removed by forceps. So usually such patients have discharge with perforation of the tympanic membrane sometime, and syringing may be advisable. The technique that is syringing may be advisable, but forceps technique are also used. Forceps techniques. But before the removal of the living object, we should kill these objects by instilling the chloroform water to kill the maggots.